All right, we'll get started here. Thanks everyone for coming out. I'm Scott Nodzo from Buffalo, New York, and I'm going to talk to you guys about augmented reality and its use in total knee replacement. So enabling technologies in total knee, as you guys walk around today, you're going to see many large console computer navigation technology, imageless-based gyroscope navigation, image-based robotics, and imageless-based robotic technology. And today we're going to talk about an emerging and newer technology using augmented reality, which is Pixee augmented reality. So we're taking large console technology and trying to miniaturize it through glasses so you can control the technology from the surgeon end. So what is augmented reality? So the differences between augmented reality and virtual reality. AR, you see the real world around you and you have superimposed digital elements, so you're interacting with a digital environment that overlays onto the total knee replacement, as opposed to virtual reality, which are the goggles, a completely artificial world that has no connection to reality. So this is an augmented reality. So how does Pixee create this environment? It starts off with a camera for tracking and smart glasses. They're all integrated into your surgical helmet. You don't need the surgical helmet, but it's easily integrated into the helmet. They have reusable instruments, and this creates the environment with QR trackers. And the trackers are reusable and consigned to your hospital. So what is this augmented reality? You don't need any preoperative advanced imaging for this. It creates the AR environment that's overlaid onto your surgical field, and the surgeon interacts with the environment while performing the total knee replacement. You can use the normal workflow that you're used to, whatever steps in order that you like to use. You can use whatever implants you want, so it's implant agnostic. And there's a very small operating room footprint, so it's nice for SPD and minimal amount of work for them to turn over trays. So this is in general the protocol summary. So you'll start out with the calibration of the helmet and confirming the protocol that you're doing. You'll select your operative side. You have, in general, a bone reference installation for tracking during the surgery. You'll acquire your anatomy landmarks, so your hip center for the femur and the tibial mechanical access for the tibia. And you'll navigate the cuts. At the end of the case, when you're done, you'll have a summary of the cuts and the surgery performed with all the information that you can save for future research, or if you like to retrospectively look at your data for patient outcomes. So starting with the femur, we'll go through the process and the steps for this. So the first two steps, you're going to pin the QR tracker in the central distal femur in line with the white sides line. I usually mark this with a bovie. And you're going to register the hip center with 5 simple hip maneuvers, and you're going to register the condyles for your digital resection depth. So this is a depiction of this on sawbones. So the QR code will go in the central aspect of the femur, and then you'll register the hip poses. And then you'll use a probe to register 3 points on the distal medial condyle and 3 points on the distal lateral condyle, and this will help you set your digital resection depth. So this is a video of me. This is how you register the hip center. You can see there is that QR tracker there. You have both those QR trackers in your surgical field. So that QR tracker on your Mayo stand is your reference tracker. That stays stable while you're doing the 5 hip poses, and then it captures the hip center. That's this picture on the lower, your lower left here is just the QR tracker pinned to the distal femur. So once you've registered your hip center and you've registered your distal condyles, you're going to attach the cutting guide onto the QR tracker that we pinned to the distal femur. And this is another picture of this. So you have your QR tracker centrally pinned, and this slides right on top of there, and you lock it into place so you can maneuver the knobs This is what it looks like intraoperatively. So we have the QR tracker and we slide the jig on, and your surgical tech will put this together on the backfield. So once you have it pinned, or once you have the jig on, you're going to set your coronal and sagittal alignment along with your resection depth based on your implant or whatever you perceive you want to resect off the distal femur, and whatever varus valgus alignment you want, and your flexion extension, just depending on your implant of choice. And you'll pin the guide and make your distal femoral cut. And this is just another picture of that. This is similar to what you will see through the goggles in this field. So you'll see the varus valgus that you're setting it through the pins, and you're going to see the flexion in the surgical field. And then at the bottom of this, you'll see the resection depth. So this is saying we're taking 8 millimeters distal medial and 10 millimeters distal lateral. And this is how it looks intraoperatively. It's pretty simple. There's just 2 knobs. You can dial it in. And so I'm looking through those glasses. I can see the change in the varus valgus alignment and then the flexion of the implant. And this can be, you can put it wherever you want. If you're kinematic, if you're true measured resection, it's your preference. You can do, you can set it wherever you want based on your implant. So after you've set that, you're going to pin the guide and make your distal femoral cut. You're going to take that central QR tracker out, and then now this looks a little more normal without all of the apparatus attached to it. Once your distal cut is complete, you can check your distal cut with another QR tracker, so you can confirm that you've actually made the cut that you intended to make. And this will be, you'll get a femur summary display, which gives you your varus valgus alignment and your flexion. Again, this will be saved, and you can use this for reference in the future for any research or patient-specific planning that you may do down the line. Very similar protocol for the tibia. Same instruments, same QR trackers. So we're going to pin the QR tracker, this time in the ACL footprint. So I will take the ACL off the bone of the tibia. I actually hold the QR tracker in the middle, and I'll pin centrally down the tibia, and then there are cross pins that stabilize it a little bit further. And this is, again, the same reference QR tracker code that we had for the femur. So at this point, we're going to register the medial and lateral malleoli, and I believe this is a video. If we could click on this one. We start. Do you mind clicking on the video for this? Thanks. So pretty simple, pretty standard with most navigation systems. So the QR tracker code is in the central ACL footprint, and then you're just registering the medial and lateral malleoli with the other QR tracker, and that sets your tibial mechanical axis. So you're going to, again, attach the cutting jig in the same manner as we did for the distal femur. And you're going to set your coronal and sagittal alignment with the posterior tibial slope. You'll again get your plateau marks, your resection levels off the medial and lateral tibial plateaus to set your digital resection depth. And then you're going to pin the guide and make a proximal tibial cut. And this is what it looks like intraoperatively. So again, it just slides on to that central QR tracker pinned to the tibia. You're going to set your resection depth, and then you can confirm your cut in the same manner as you did for the femur. At the end of the case, this is your summary display, so you can see the theoretical hip-knee axis that you planned on the left here, and then you'll see the varus valgus alignment of the tibia and the posterior slope, as well as what you resected. So this is saying 5 millimeters medial and 2 millimeters laterally. And at the bottom of that, you can see what you had done with your femur planning. So this is your summary display. So of course, you want to know, is this accurate? As with any technology, there's been multiple case series studies looking at consecutive series. 96% of the alignment is within 1 degree. I've had excellent results with my experience with it so far in my implant balancing. So your take-home messages here, it will accurately align your coronal and sagittal plane cutting guides. It's completely surgeon controlled. There's really the only thing your surgical techs have to do is put that jig together, which is just sliding two pieces together and they hand it to you. Otherwise, you do all the registration, you do all the calibration, and it's all done through the goggles with tilting of the head and voice control. It's implant agnostic, so whatever implant company that you like to use and what you're comfortable with, you can continue to use them. There's a very small operating room footprint. There's no advanced imaging necessary. There's no capital cost. It's a pay-per-case system. The glasses and the trays get consigned to your hospital so they don't come in and out. And then this technology has a very high ceiling. It's rapidly evolving. The genius behind the technology is in the back there, and all the software programmers setting up how this technology works and the miniaturization of the QR codes and the trackers as this continues to evolve. So this is the current generation of Pixee. There's 5 acquisition landmarks for the hip center. It's voice and head controlled, so you can talk to it kind of like you do with your Siri. And then this does integrate into the new Stryker helmets if you use a helmet during surgery. So how do we implement this? Check out the booth. We're at 1311 down the road here, at the end of the carpet here. They'll come to your hospital and help you set up the technology. It's a very small learning curve. I was time neutral in about 3 cases with this. It's pretty straightforward once you get used to looking at the jigs and the technology. It's very straightforward. There's no capital cost, so you don't have to put a lot of money up front to get this. It's pay per case. And like I said, the glasses and trays are consigned. And there's a very small operating room footprint. You don't really need a sales rep. They'll help you set up. And once you're comfortable, I haven't had a sales rep in the room in a while here. And that's the whole footprint. That's all you need. It's that little tray on the corner of the back table. So it's very streamlined and straightforward. Thank you. Any questions? All right. We'll be at the booth if you guys want to come check it out. Play with the glasses, play with the sawbones. It's pretty neat. Okay. The rotation, it does not do rotation yet for frontal rotation. So we still use whatever implant company's external rotation guide that you use based on what you prefer to do for your external rotation. All right. Well, thank you very much for coming out, and have a great rest of your academy.